The widow of actor Robin Williams revealed following his suicide that he was in the early stages of Parkinson's disease. Samantha Elandary is the founder of the Parkinson Voice Project. Why the Voice Project? That is something, we think tremors, we think an unsteady gait, but the voice is also impacted?
90% of people with Parkinson's will develop some type of speech difficulty and swallowing difficulty. And so at Parkinson Voice Project, we specialize in restoring the voices of those with Parkinson's. And when you strengthen the voice, the swallowing can get better too.
When the diagnosis first comes, how is it seen? There's no blood test, there's no MRI, X-ray, anything like that that is going to say, oh, you have Parkinson's.
No, diagnosis of Parkinson's is typically made through clinical observations. So a patient will go to the doctor and the doctor will have him walk down the hallway and maybe do this and do this. And within minutes, a neurologist can determine or suspect that the person has Parkinson's.
There is no cure. Is there a treatment?
There's a lot you can do to manage and control Parkinson's, and I think that's something that people don't realize. Finding a movement disorders specialist, a neurologist that specializes in Parkinson's, taking the medications, physical exercise, and of course voice therapy. Stress is a big factor for people with Parkinson's. They need to reduce their stress because stress can exacerbate all of the symptoms of Parkinson's.
Is depression, Robin Williams was already fighting depression. Depression, I would think, would be a natural reaction to that diagnosis.
I think for anybody that has a medical diagnosis like that, but it is reported that up to 60% of people with Parkinson's might experience mild to moderate depression.
Is it the type of disease where there is one cause and thus we hope someday one cure?
We don't know what causes Parkinson's. There's a lot of speculation about genetics and pesticides, and we don't know what causes it, so we don't know how to cure it. But it can be treated. At Parkinson Voice Project, we have a two-part voice program. The first part is an intensive one-on-one therapy program where patients come for a month and meet with a speech-language pathologist and strengthen all of the muscles of the speech and the swallowing. The second part of the program is like a support group. It's called the Loud Crowd, and they do voice exercises, but they also meet and learn about the disorder and talk about their life experiences, and I think something like that is very helpful and beneficial to people, especially if they're dealing with depression.
Right. I suspect that keeping the voice active and keeping the body active are both part. If I sit back in silence in my chair and don't move, my voice and my body are going to start to deteriorate.
Parkinson's is a movement disorder, and it's battled by moving, both physically and vocally, yes.
So it's a challenge, but you have to work at overcoming the challenge.
Parkinson's destroys the automatic function of the brain. So things that used to be automatic are not automatic anymore. People have to use a different brain pathway. They need to do things with intent. So we teach patients how to speak with intent, how to focus, concentrate. But when they learn that at Parkinson Voice Project, then they can apply it to other areas of their life. They learn to walk with intent. Write with intent. Right. We tell people at Parkinson Voice Project, use your CEO voice, or how would you walk into the room if you were the president? And because because they're thinking about it, that brain pathway does not require any dopamine. Automatic movements require dopamine, which is what Parkinson patients, they don't have enough of.
Terrific. Great advice. Thanks so much. And we have a link to the Parkinson Voice Project on myfoxdfw.com. Click on links on the Good Day tab.